We start with Professor Peter Hellings of Leuven, Belgium, well known to all of us for his contribution to current research on the subject. We will try to squeeze in 20 minutes all important information on the pathophysiology of CRS. And will help us to understand better the lectures which will follow. Peter, thanks very much for being with us, and the stage is yours.
Thank you, Mr. President of this wonderful Hellenic Society. For me, it's a true pleasure and privilege to take part in this wonderful panel with topics that are really very interesting. And the interest is also reflected by the large number of attendees now, not only from Greece, but also from the rest of the world, which is really impressive. And I congratulate you, Tim, as well as the Hellenic Society for this major achievement. I see my first lecture as a sort of warm-up lecture, paving the way for the lectures that will come during this symposium, because I will just give a brief update on where we stand with CRS care anno 2022, with some strengths, weaknesses, opportunities, and threats, and focusing then on the pathophysiology and how this insight in the pathophysiology might be used for better care. We all know, and going to the strengths first, that we have some insights in the underlying pathophysiology of CRS, and this is mainly applicable to CRS with nasal polyps, driving chronicity of inflammation with local IgE, IL-4, IL-5, and IL-13 around. Each of these cytokines are associated with some aspects of the disease and the inflammation that we experience in our patients, and I'll come back to that later on during my lecture. One of the other strengths is that we have good guidelines with comprehensive overviews of where we stand today in relation to effective treatment options, and I tend to refer here to the EPOS 2020 document that is published in Rhinology and also available online, where you find how ENT physicians and more specifically rhinologists should deal with patients suffering from chronic rhinosinusitis. Given more and more treatment options, we could apply precision medicine principles into the daily practice, taking into account that prediction of success, participation of the patients, as well as preventive strategies, and last but not least, personalized care, are all implementable in patients coming to seek a solution for chronic sinus disease. We reviewed the strategies of precision medicine in relation to primary care, secondary care, and tertiary care in a publication in 2017. And when we talk about personalized care, we go into endotyping of rhinosinusitis, and this is a scheme that we published last year where we define the endotypes a bit arbitrarily into type 1 endotype, type 2 endotype, the neurogenic endotype, and the epithelial endotype, giving rise to the symptoms for which patients seek solution. As this is the Hellenic Society with rhinologists being present, all of us know that these symptoms could be induced by type 2 inflammation, type 1 inflammation, type 2 inflammation, and also with nasal hyperactivity, reflecting the neurogenic pathway in 2/3 of patients suffering from chronic rhinosinusitis. And last but not least, sinus surgery is well developed. I'm sure you will have wonderful lectures about the latest standards in sinus surgery, and this opens good opportunities for best care in patients. And last but not least, in 2022, we have in several countries worldwide the option of having more than one biological available for our patients suffering from chronic rhinosinusitis with nasal polyps, and studies are ongoing, phase 2 and phase 3 studies on biologicals also for CRS patients without nasal polyps. So we have multiple strengths, but despite these strengths, we also have the weaknesses, opportunities, and threats that we should consider. And this is just an introduction of where we stand with CRS care, paving the way, for instance, for the next lecture of Richard and also the other lectures where optimal care is being discussed. But when we talk about the weakness, many patients remain undiagnosed and as a consequence of that also undertreated. And this was actually found remarkably well by one of our real-life digital tools, My Sinusitis Coach, that we implemented in Central Europe, where we found that up to 50% of patients seeking care for CRS actually have uncontrolled disease. And this is, of course, not a surprise because they go to the physician. But what is more surprisingly is that despite physician care and despite guidelines being available, up to 50% of patients with chronic sinus disease may remain uncontrolled, applying the EPOS criteria or just a VAS score for defining a patient as being uncontrolled. There seems also to be a lack of coordination of care and a transition of care between pharmacist, primary care, specialist care, and also tertiary care level. And in reality, we see that many patients remain frustrated about the care pathway because there is a delay of getting optimal care or adequate treatment advice. This is just a reality that we are confronted with in everyday practice, especially more so in tertiary care centers, where we see patients that have had a long disease journey and where, for instance, lower airway disease or comorbidities have never been taken care properly. We are also to be blamed because there is inconsistency in guidelines and therapeutic advices. And especially more if we look at European guidelines, US guidelines, Australian or British guidelines, as well as the Euphoria guidelines, there is no full consistency in between or across these guidelines, and that is something we might improve in the future. For instance, we have Euphoria indications for guidelines that have been adopted in the EPOS document with also some fine-tunings. These fine-tunings are always a step forward, but I can imagine that these guidelines and inconsistency might lead to some confusion. And last but not least, there is limited political awareness. And there I bring here to your attention Euphoria, which is a European initiative founded in 2015, where we try to bring to the health policy makers the importance of proper sinus care, proper care for respiratory diseases. And there I will briefly highlight that in the end of April 2022, we will have the first global CRS nasal polyps awareness campaign in the European Parliament organized by Euphoria. And talking then about the opportunities that we have because of the weaknesses, there is the opportunity to implement optimal care, to also consider preventive strategies, because if we think about the studies of Claire Hopkins and the nationwide surveys in the UK, we know that timely treatment for CRS might have a huge preventive potential, not only to arrest the chronicity of disease, but also prevent the progress from CRS to asthma. We have optimal care pathways to be implemented, leading to a gain in quality of life, also health economic savings, and last but not least, we need a strong patient advisory board, and that is what we have been investing a lot of time on with the Euphoria board. And now we have a very active patient advisory board from Europe, patients suffering from severe chronic sinus disease and comorbid allergies and asthma that help us to fine-tune and to optimize care pathways, ultimately leading to better care for all our patients suffering from chronic sinus disease. And we take testimonials of these patients, we reflect on what has been frustrating them, as well as how they think they could contribute to better care pathways. And one of the documents that these patients came forward with is a document that is recently published, where they list the benefits and the shortcomings of pillars of care like oral corticosteroids and endoscopic sinus surgery, where patients of the patient advisory boards coming from different European countries express their perceived benefits as well as their shortcomings related to oral corticosteroids and endoscopic sinus surgery. And what is also nice is that these patients can help us as healthcare providers to have a better coordination of care, to also have more multidisciplinarity in our approach of these patients, and also have access to better and novel treatment options. Having said that, I would like to go back to the pathophysiology, where we clearly distinguish type 2 inflammation with mainly neutrophils and the type 2 cytokines like interferon gamma, which we mainly see in patients with chronic sinus disease without nasal polyps. And in those with type 2 cytokines, we find the typical IL-4, IL-13, IL-5, and IgE being present as we see in patients with nasal polyps. And we often talk about these type 2 cytokines because we have novel treatment options, and we also know that the presence of eosinophils or the presence of specific of these cytokines are responsible for recurrent disease even after sinus surgery. We recognize also other endotypes like the neurogenic and the epithelial endotype, which should not be neglected when we discuss novel treatment options. But what is also good to know is that we can find these cytokines not only in the serum, in the blood, but also in the nasal fluids. And we can clearly find that in patients with nasal polyps, several of these type 2 cytokines are elevated compared to those patients without nasal polyps. But what was for me a wonderful study performed by the group of Stevens in the US was that in the majority of the patients that we see with nasal polyps, as well as in the majority of patients that we see with CRS without nasal polyps, you have a mixed cytokine profile. So these endotypings may be important for us researchers and clinicians to understand better the pathophysiology, but in reality, many of our patients present with mixed endotypes, also helping us to understand why, for instance, not all patients with an increased, for instance, IL-4 and IL-13 levels respond well to dupilumab, and why some others with high IgE levels, for instance, do not always respond well to omalizumab. So we need to understand that these mixed endotypes are actually very important in the real life of patients that we treat for the problem and the inflammation that we see. And these mixed endotypes is actually a good concept for us also to understand what is ongoing. So I do believe that the future of CRS research and care will mainly be linked to some of the topics that I really like to share with you. One is that we need to define clear biomarkers that predict success and failure of treatment with either sinus surgery and or the novel biologicals that we currently have. Richard Douglas will inform you about his insights, which are very exciting, about the microbiome and how the microbiome might also play a role in the chronicity of disease and help us to understand why patients do well and why some others may not be doing so well after sinus surgery and or biological treatment. And I can tell you that from our research group, we do know, for instance, that patients with CRS have a deficiency in lactobacilli, and that when we restore these lactobacilli in animal models, these animals do much better when it comes to inflammation and restoration of the homeostasis in the upper airways. Also, the role of the mucosal barrier as well as lifestyle will help us to understand better how we can optimally treat our patients with CRS problems in the future better. Last but not least, also real-life data on therapeutic responses to biologicals are actually needed to understand therapeutic response rate, the speed of success, the comparison, the direct comparison of efficacy of the different biologicals that we currently have. And we also should invest more in secondary and tertiary prevention. Having said that, I hope that I have given you some food for thought on where we stand today with CRS care anno 2022. And I'm so proud to be able to announce you that our Euphoria team will organize in 2 weeks' time the first global CRS nasal polyp awareness day in the European Parliament with health policymakers, with physicians, with Professor Witzke-Fokkens and many other colleagues that will all bring testimonials that will discuss the strengths and the shortcomings of CRS with nasal polyp care pathways today, and hopefully leading to more understanding of the burden of this disease, and hopefully also paving the way for better research and also better care of our patients suffering from chronic sinus disease. And last but not least, whenever you want to learn more about Euphoria with the seat in Brussels, and there I have a conflict of interest because I'm deeply involved in this organization, I kindly invite you to join us at one of our events or join us at social media. I think I've come to the end of my short introduction to this wonderful seminar. I'm more than happy to take questions at the end of this webinar, and I thank Tim for the kind invitation, and I hand over to the chairperson, Tim, again to introduce the next speaker. Thank you very much for your attention.
Thank you very much, Peter, for the wonderful presentation. Of course, the subject is too complex to can be squeezed